that we will also today be having an opportunity for lots of questions at the end. So on the bottom of your screen, you'll see a Q&A function. Your chat function and also your raising of your hand is disabled. So if you want to ask a question, go to the Q&A button and you can just type your question in. I'm going to take you through a presentation, and feel free to ask questions as we go along here. You don't have to wait until the end. You can ask questions at any point. Just type them into the Q&A, and then once I finish my presentation, I'll move to those questions and answer those questions. So I'm going to go ahead and get started, and please, like I said, feel free to start to type in questions as we go through the slides. So this presentation today is about our DBA in health. It's the first DBA that we've had at UCL, and it's a really exciting program. So before I get talking about the DBA in more detail, I just want to talk a little bit about the UCL Global Business School for Health. We're the first business school in the world totally dedicated to educating the next generation of health and healthcare managers and professionals. The whole idea behind the school and the story of the school is that in about 8 years ago, there was a consultant, a strategist in a very large firm who asked the question, with healthcare rising at such a rapid way, GDP increasing across the world, more and more people aging, climate change, all of these things, why don't we teach better and more about health in business schools? And so with that, UCL decided to create a business school solely dedicated to health and healthcare, an opportunity to really take a business management lens to that sector, and also to reimagine global healthcare management. As we know, we can hire lots of clinicians, but it's the processes, the pathways, it's the management, it's the leadership, it's the values, the purpose. And these are things that I hear constantly in my work and as I go around meeting people in various roles within the health and healthcare sector. So really the idea through this DBA, and it really aligns with our mission and our values, is to unravel those health challenges from a business perspective, but in a way that applies research and helps to make a much more evidence-based approach to answering the challenges of health and healthcare. So why gain then a focused DBA? And this is an important question. So it is, as I just said, about gaining the ability to apply research skills to address health sector challenges. And of course, today there are numerous challenges and many things that we need to evidence and to find applied ways in which to solve some of the challenging problems that we face as a society today in the health and healthcare sector. It's also an opportunity for you personally to reach new heights in your career. We have a number of people who do the DBA Health for lots of different reasons. Some because they're in a research role and they'd like that application and ability to apply their skills. Others who have achieved much in healthcare management and leadership, and again, would like an opportunity to contextualize that and to publish it and to work in the area of research. And then, of course, there are individuals who see this as an opportunity to really pivot their career, to take it to the next level, particularly in terms of policy and consultancy roles. So there's many reasons why people would do a DBA Health, and there are different career paths for those individuals. Also, personal and professional development, gaining that self-confidence, accelerating your career can be a very important part of this process. And I would hope that anyone who undertakes this DBA will see much personal growth and development as they go through the program. The other thing is that research at UCL Global Business School for Health is varied. We're an interdisciplinary faculty made up of people from different backgrounds. So the opportunity to do applied research across a wide spectrum of topics is a unique experience. It wouldn't be found in more traditional departments. So being at UCL, world-class institution, and being moreover in a department with world-leading scholars in lots of different disciplines offers you an opportunity to really take very novel research ideas forward in terms of your thesis. So just really to highlight some of the things that we'll talk more about as we go through around this DBA Health. So the DBA, the Doctorates in Business Administration Health, it is a professional doctorate, and it is equivalent to a PhD, but it's designed to be and provide more flexibility for professionals who are studying while working full-time as senior health leaders or managers. So it is constructed slightly different over a longer period of time than a traditional PhD. I see some real advantages as well. When you do a DBA, you come in as a cohort, so you'll have other people who will be learning alongside you as you move forward. And that really creates a camaraderie that can lack sometimes, particularly in UK PhDs, where you're working very much on your own most of the time. So it's conducted in kind of 3 stages, 3 parts. In the first 2 years, you have a taught element. So in year 1 and 2, you're going to take modules. And those modules are designed to help you really get a grounding in research methodology. And the research methodology will be very focused on applied research in the kind of health and healthcare health systems ecosystem. So it will be mainly in your first module. You'll take a module around applied research and healthcare management. You'll cover a lot of literature, but really what we'll be doing there is helping you learn how to critique journal articles, how to understand key academic sources and publications that will be very relevant for you in this program. And then you'll move on to there to that's the module you'll take in your first term. The way it'll be taught is it'll be mainly online, and then you'll have a 1-week intensive week where you need to come to London, or if you're in London, you'll attend during that week, and we'll be publishing those dates shortly. And then you'll have some work afterwards, and you finish off your assessments. So although you'll have online virtual interaction, both synchronized and synchronized, you'll also have that face-to-face in-person week. And so the program is really a hybrid. It's a mix of distance learning with this in-person component as well. And that in-person component will be really important for you for networking reasons, to get to know the people in your cohort, to have downtime with myself and your program leader and others who will be teaching on this program. And then you'll come in term 2, you'll have research design, and in term 3, which starts into the summer term, you will have research methods, both quantitative and qualitative. So that will be your first year. And then your second year will be similar, except the difference in your second year is you'll have an option to take either a module in systems thinking for healthcare or one in digital health as preparation for your final term. You'll also have a course in co-production in terms of healthcare and research. and that's co-production with patients. It's a really fascinating topic and course, and very timely. And then in your final third term, you will put together your research proposal for, you'll be assigned your supervising team. You'll have a primary supervisor and a secondary supervisor. You'll also submit your for ethics approval, so you can undertake your research and data collection. And then that will end your 2 years of taught. And so then in your, in between that, the next part is you will do a professional practice portfolio. And that's really an opportunity to get you to reflect on all the learning you've done in those first 2 years in that taught component, and think about its application, particularly in terms of your workplace. Now, while you're completing that professional practice portfolio, you will have already started on your dissertation, your thesis. And so your third year and moreover your fourth and fifth year will be dedicated to finishing up your research thesis that you will then submit, and there'll be different stages for that as well. So it's 5 years and it's part-time, but there's lots of interaction and pieces. Also, in your last few years, you'll have the opportunity to be part of a DBA PhD conference that we'll hold in the school each year. So you can come and present your work and get that opportunity also of presenting and honing in your skills so that you can confidently apply to other research and academic conferences if you were amenable, or professional, conferences. So that's really just a broad overview of the program. And, UCL is an amazing place. There'll be lots of opportunities through the doctoral school for you to attend additional workshops. And, we highly recommend that. There'll also be other forums. There'll be conferences, again, other conferences for PhD and professional doctorates, DBA students to attend. So there's lots of opportunities, and some of that will be optional. You can dip in, you can dip out, and then of course your core program. And UCL, by the way, is ranked second in the UK for its research power. It's of course 8th in the world, and much of that research power comes particularly from the disciplines of medicine, health, and life science. So when you couple that with the Global Business School for Health, it's a fantastic place to undertake your research and your doctoral work. You're also, not just in a top 10 university, but ranked 7th in the world for global health on the Shanghai rankings. So together, I'm very, very confident that you can have an incredible experience as you take this doctoral program forward. The other thing is, when you come to London, we'll ensure that you have opportunities to network with lots of different professionals across the health sector and the health ecosystem here in London. So, what makes this DBA Health stand out? Well, first of all, I actually think it's the first professional doctorates and doctorates in business administration health in the world. So it's a very unique offering. And moreover, UCL's Global Business School for Health is a place where we really understand the healthcare sector, and we understand it in its complexities. And as I've already mentioned, we have a team of really fantastic interdisciplinary scholars who will be keen to work with you. Our program has been specifically designed for healthcare leaders with cutting-edge contemporary topics. And our lecturers and research advisors are really world-leading in their fields, but they're really interactive, not just in the academy with other academics, but they are constantly interacting with people from the sector. So we're very close to employers, to what's happening on the ground in this very important sector. We've also have recruiting agencies that work with us and to help evaluate and look at what we're doing and achieving across our programs. And of course, we have a terrific cadre of alumni that we're putting together. And as an alum, you'll have access to our executive education at a significant reduced rate that you can, again, dip in and dip out of throughout your rest of your career. So the networking opportunities and the connection to a world-leading organization and the continuous education are really part of this unique offering. So who are our students and who do we anticipate coming on to this program? A typical healthcare DBA health student would be someone who is already a health professional, wanting to gain an applied research background to drive forward an evidence-based approach. They could be a senior staff, someone in a senior staff position wanting to just enhance or refresh their skills and knowledge without taking a career break. Often too, people who have MBAs or master's degree and are looking for an academic challenge, kind of something to really a terminal degree, and that is what a doctorate is. It's the kind of final degree, the final level you can get in the academy. Those are individuals. And then, of course, professionals that might want to just pivot over more into healthcare management. So as I've already said, the program provides you a professional doctorates for you as an individual to really take a step into this kind of research environment and get those applied research skills. It's mainly taught in a hybrid manner with online taught modules, but with in-person intensive a week of training in your first 2 years. And then in your third, fourth, and fifth year, you're focused on your thesis, but you'll also have that step where you'll do your professional portfolio. So it's a great opportunity. Just some key information. Our class starts in September. The duration is 5 years part-time. The location is distance learning with termly 1 week in-person education here in London at our UCL East campus. And the building there in the picture in the back is our Marshgate building. It's opening up in the next few months. We have an executive education suite in there that's just fantastic, and that is where your face-to-face teaching will take place. The cost is $12,100 annually for UK and overseas students, and it's an annual fee. So I've really gone over this, but it's distance learning with flexibility and with the added week for the first 2 years to bring you to campus. So if you're overseas, that is not optional. You will have to come and do the face-to-face components of the program as well as the distance learning. So that totals 120 credits that you will earn in the first 2 years, concluding, of course, with your thesis proposal that will inform the rest of your program. Now, if for some reason you couldn't continue on the program, but you have completed those 2 years of taught, you would be awarded an exit award, which is a professional, a postgraduate diploma in research skills for business administration and health. We've done that because we do recognize that sometimes people with all the best will in the world may have complicating circumstances that may not allow them to finish the doctorate. So you would be able to have an exit award if for some unforeseen reason that was the case. Then, of course, I've already mentioned the professional practice portfolio. This is the reflective assignment, which is a 5,000-word reflective essay that encompasses your readings, your critical analysis, and your professional work reflection. And then the third part, of course, is a 45,000-word doctoral thesis for your professional doctorate. And in that year 3 to 5, as you advance your professional doctorate's preparation, the first step will be your research proposal with ethics approval by the DBA committee. Then you'll prepare that final thesis. Then you will have to have that accepted by the DBA committee. And then last but not least, you'll present it and successfully defend the thesis, both in terms of submitting the written work, but having an oral viva examination. So what are we looking for in terms of individuals? Ideally, you need to have a master's or an MBA degree, with a kind of minimum grade equivalent to a UK 60% or other overseas equivalents, so that translates in UK language into a 2.1. We will consider people with extensive work experience, but you would have to be able to evidence that your work experience is equivalent to a master's degree or an MBA. In terms of language requirement, you need an IELTS or equivalent, based on tests that UCL accepts, of a 7 or above. And in no area can you have less than a 6.5. In terms of background, you should already be in the health sector to apply. That applied bit and being able to think about and contextualize what you're doing to the health sector is really important. We would accept someone who can make a strong case of why they wanted to pivot into the health sector through this program. But again, we would need a case for that. Our current application deadline is the 31st of March. And you need at least 5 years of work experience post your first degree. There is an interview that you will have to take after submitting your application. And then also you'll need a personal statement, and 2 references are required. So if you're thinking of applying, I suggest that you apply sooner than later, because it is a very busy research process. These are just some of the people, myself, to give you just a flavor of some of the people at GBSH. But if you go onto our website, we've got a list of individuals who are able to supervise research. Also, I'd just like to add that you can always have someone outside of the department on your research supervisory team as well. So you can look across. And we have a fantastic program leader joining us in June. His name is Professor Sim-Cha Chong. He's coming from the Netherlands. He's been at UCL previously. He does work in research and development and innovation in terms of health systems design. And again, just some other people that you might want to look at. So that's really the end of my presentation. I hope you found that useful. We've got other sessions coming up. There's one on scholarships and funding information that's next week on the 14th, around about the same time. You can also always email us. We're here to support you. We want to make sure that you have the best experience you can. You can find more information about our programs on our website. But moreover, I just want to really emphasize that our admissions team is there for you. They can also arrange a one-on-one to speak with me. If you've got specific questions that you don't feel comfortable putting into the chat today, I'd be more than happy to have a call with you. So I hope you found that presentation useful. I'm going to stop sharing now, and I'm going to move to the Q&A. I see we've got a few questions, so I'm going to go through those currently. So at what banding in the NHS are seen as senior health leaders or managers? Well, I'm not as familiar with the exact banding. I would say what constitutes a manager or a senior leader is someone who's able to make decisions, who line manages other staff. So if you're in a role where you have that ability, what we're trying to avoid is people that have no management role, who cannot necessarily don't line manage anyone. So if you're currently line managing someone, and if you are or you're making decisions about a unit or a department within the hospital, that would definitely constitute someone who's at the senior leadership or management level. Then the next question, for those of us not in the UK, how many face-to-face weeks in London will occur over the duration of the program? Also, at what time of the day in GMT do synchronous classes typically take place? So what we'll do, Liz, is we will have 2 different times. We'll run each session that's synchronized will be ran at least twice to make sure that we capture different time zones. So normally we'll do one in the morning around, say, 9 o'clock GMT, and then we'll do another one around 3 o'clock in the afternoon. And our experience is that normally those 2 times with that 6-hour window allows us to catch most of the world and people who have actually woken up in the morning. And then the other thing in terms of face-to-face, so you will have to come 3 times each year in the first 2 years. Then in your year 3, 4, and 5, ideally we'd like you to come for the conference, that we would have for our PhD students, and come at least once a year. But we're not mandating that. It's not written into the program, so you could work with your supervisor virtually over those last 3 years. But I think it would be a tremendous experience, of course, to come at least once a year. But you do have to come 6 times in the first 2 years. And I think that's a really good practice. It'll help you to get to know your supervisory team, and so to pick them out. You'll bond with the rest of your cohort. You'll get to understand UCL, the facilities. So I think all of that will help your onboarding. And then when you get to your thesis, it will help you have that resilience and ability to work forward. So what is the approximate weekly workload in hours over the duration of the program? Is the program flexible for those working full-time with family responsibilities? Well, I'd hope so. That is the intent. When you take your program, most of the work prior to your coming for your week will be asynchronized, so you can work through that. So you'll have really, across a 10-week term, you'll have most of that time to work through that material with, so our terms are 10 weeks, and you'll have that 1 week. And so I would say you could probably anticipate 6 hours a week, something like that you might spend on the material. It will depend on you, of course. You might end up being able to spend less. You might do it in different chunks. So the idea is to give you that flexibility, and that's why most of the material and most of the work will be asynchronized, so that you've got that flexibility and you can work it around your family and your work life. And then, where we expect you to really be in the room, as it were, is when you come for that intense week. So prior to that intense week, you'll have different assignments. Of course, we're going to want you to do quite a bit of reading, particularly at the beginning. Without pulling out the exact sheets, I'd say, you could anticipate, maybe 2 to 4 hours, depending, again, it all's going to depend on you, your background. Some people will want to do more reading, more preparation for when they come for the week. And some people will just not feel like they need as much preparation. So I think it will also, people have different strengths. So there may be some modules where you feel like you need to put a little more work into them. And then there may be some that you can put less. So I know that's not an exact answer, but I think given my experiences with online learning and myself, I did my master's online, working full time and also with a family. And I found I could just chunk it and use Saturdays as a time when I would do my work. And I, given my background and where I was in my career, I didn't feel that I needed too much extra time. But then I knew other people who were spending much more time on the modules. So without knowing your background and where you're coming from, I would say, that's a kind of an approximation. How many years cohorts has this program been running? How many students have graduated from this program? Liz, this is a brand new program. The Global Business School for Health is just 2 years in running. Of course, we've had lots of PhD students across UCL, and most of our academics have supervised PhDs previously, but this is a new professional doctorates program. So you would be part of the first cohort. I'm a British national and studied in America. Do I still need to take the IELTS? No, I don't believe you would, but if I could just ask you to check with admissions. If you're a British national and studied in the US and have a degree from an English speaking institution, I would imagine you don't need to take the IELTS. Can I do my research in environmental health management? That would be something that you would design and decide on as you go forward. On the surface, it's not an area that I do research on, but I imagine that across UCL and with someone in our department, that we could accommodate that. UCL is a comprehensive university with 16,000 staff. So we've got people working across lots of different areas. So if we don't have a direct primary supervisor, I'm sure we can help find someone within UCL that can help support us with that research topic. And again, that's something, don't feel pressured to come in with a specific topic. That's great if you've got something like that. But many people within those first 2 years, part of that experience is also to help you hone in. You might, after you start to dip into the literature, think about research design, there may be other questions that come along that you had never thought about exploring. So I really ask all of the students that come onto this program, it's a really unique program and a great experience to get those first 2 years of top modules and to really make sure you have no gaps in your research and abilities prior to really undertaking your thesis. So given that you've got that opportunity, I highly recommend that you come in with a little bit of an open mind and a willingness to possibly explore other things, because you might find that you want to do that. Okay, do your supervisors and lecturers have expertise in management within mental health? No, currently we do not have people with expertise in mental health. We do have someone though joining us shortly. And so by the time 23-24 comes around, we will have someone. We've got a really excellent behavioral health psychologist joining us, and she'll be in the department. So she may be an ideal person for you to work with. Okay, is there any other questions? And to that last point, because we are a new department, we've got a number of people who will be joining us in August and next year. And so don't feel limited when you look at the staff that we have now. And again, when it comes to your thesis, we can also bring people from other departments in to supervise. We want to accommodate our students as best we can to make sure that they can undertake and research the topics that they've developed through their first 2 years of taught work. All right, well, I don't see any more questions in the chat. And so if there are no more questions, as I said at the beginning, you can look online, you can see the modules, you can see the website, you can see how to apply. If you'd like to book a one-on-one with myself, just go to the admissions mailbox and let them know. And I really hope you join us. I look forward to having a very exciting, engaging class as we go forward. And we're really here to support you and support you making a decision. I know it's an important decision and a big decision. So any additional information or support that we can offer as a department, we're really excited to offer that to you. So again, thank you so much for your time and have a lovely day, lovely evening, depending on where you're at.